EGM Network.
Good afternoon, and welcome to Community Conversations. So glad you're able to join us this week because we have, as usual, wonderful guests that we're going to have a conversation about. And it seems especially timely because everyone is talking about mental health these days, and with good cause. So we know that mental health often is, quote, treated by some addiction types of things, whether it be drugs or alcohol. Self-treatment is not unusual in those with mental health issues. But we know that there are some wonderful things going on in our community through the previously known as Substance Awareness Center, now Thrive. So welcome, Carrie. Welcome, David.
Hi, Vicki. Thanks for having us.
Good to have you here. So tell us about your changeover from a name that you had, well, at least SAC has been known in the community for 30...
For almost 35 years?
That's what I thought. Yeah. And so instead of renaming it with another SAC acronym replacement of words, you went in a completely different direction.
Yes, we definitely did. And it was very intentional, the rebranding process. And I know for me, for the years that I've been in a leadership role at what was the Substance Awareness Center, I knew intuitively we did so much more than just substance, and we know that substance is limiting. Mm-hmm. We are preventing more than substance use disorders, and we are treating more than just substance use disorders. And so we wanted to challenge ourselves on that name, and we also realized that the word substance could be stigmatizing. And
it still is. Absolutely. And it's a fear-invoking from the 1960s when heroin was the big problem.
Mm-hmm. Yep. So we asked ourselves, kind of embarking on that journey, really one fundamental question, which is, across the vast array of services we provide, what is the single outcome we want to see? And it was our chief clinical officer. It didn't take long for her to say Thrive, and all of us nodded in 100% agreement. We were all in agreement that Thrive is really what we wanted. We love this community that we live, work, play in. We want to see it thrive. We want to see the youth and the families we serve thrive. Mm-hmm. And of course, anyone with a substance use disorder, we want them to do more than just survive. We want them to thrive. So we are Thrive.
So I apologize because you and I see each other on such a regular basis. I ignored my hostess duties in introducing you to those that are on the other side of the radio. So I'd like you to not only introduce yourself, but your compadre here that you brought.
Yes.
If he can get a word in edgeways with us.
Good catch, Vicki. I am Carrie Lester. I am the CEO of Thrive, and I am here with David Flint. He is our chief operating officer. I cannot get those words out.
Yes. So David, what do you do? Since she's having trouble describing this title.
Whatever Carrie needs me to do.
I see. Okay.
So I help run day-to-day operations within the organization, overseeing finance, human resources, physical plant, and grants.
Okay.
A lot of different things. I keep
a lot
busy.
of different hats. And how many employees do you have working with you guys now?
We have 28 full-time employees right now, an intern that just came on, and 3 part-timers.
And a new building.
Yes.
Yeah, that's a big change.
That has been a transformational change in the way our service delivery really works and operates. I probably had been on your show before talking about how disjointed we were as we've grown over the years. We, in my tenure as CEO, we began to occupy 3 additional spaces in the downtown area. I think we were in 4 by the time we moved last February into this new location. So we are now under over 8,000 square feet, all under one roof, all of our programs and services operating really with increased efficiency, effectiveness, and synergy. We do have a location in North County where we still do drug testing and prevention services, and we will be adding some clinical treatment services there within the next few months.
And where is that at?
That is right off of Bay Street.
Bay Street in Sebastian.
Oh, okay.
Right near Roseland Road and US 1 in that Bay Street.
Not too far from Treasure Coast Community Health.
Correct. Yeah, really just a stone's throw from your location there. So we started off our partnership with Teresa Toll at Bay Street Pharmacy. She donated that space to us to kick off some drug testing services because we realized
it's quite a
the barrier.
From Sebastian to back to
And then
Vero.
as we look at our demographics, we started to see how many prevention kids we had. We wanted to serve North County, take the ease and the burden off of those families. And then obviously it is ideal to provide some treatment services to take the ease off of our clients who live in North County.
So let's talk about some of your treatment services for people who aren't familiar with the old you and kind of updating to the new you as Thrive. Your two main headers, I'm guessing, are prevention and treatment.
Yeah. And so I tell people with the new name, although our name has changed, our services really have not changed. We organize ourselves around different mission pillars, but our primary programs remain the same. Prevention works and recovery works. And so in those prevention services, we really want to protect that vulnerable developing adolescent brain from the harmful effects of substances. So we provide universal prevention strategy in our community. Our goal is for every kid to get universal prevention education. And so we have a reach of about over 4,000 youth.
Over 4,000 youth. Yeah.
Through our partnership with the school district and youth serving organizations and summer camps, we bring evidence-based curricula to the youth in our community. And then if kiddos get identified as engaging in a health risk behavior, we're serving about 300 kids and their families.
A little over that, right? Is the target this year.
Yep.
And is that where they have replaced suspensions with some sort of, I don't want to call it a legal issue, but some sort of shame on you, you shouldn't do that?
Our community has a couple of different citation programs that law enforcement makes referrals
I'm
to
sorry.
us. Yeah, that's
Sounds
all right.
stupid.
But it really, it's important because we don't want kids to have a fingerprint for life. And so the Department of Juvenile Justice has identified and researched civil citation as an option and championed that across the state of Florida. And so we work closely with our court system and our law enforcement partners to keep kids out of the system, because we know the research says if we keep them out of the system, the outcomes are much greater for them.
And those citations are tied in large part to things they shouldn't be doing, like vaping in school, correct?
And any misdemeanor offense. So law enforcement has the discretion. If a youth commits a misdemeanor offense, they have the discretion to use the civil citation program, make direct referral to our organization. We hold those kids accountable to complete the prevention interventions we put in place for them. There's a community service component to it. And if they don't follow through, we send that back to the law enforcement agency and the state attorney's office for prosecution through the juvenile justice system.
What's been the reaction of parents of the kids that are now getting citations? Pretty positive? Somebody's holding them accountable, or maybe 50-50 split?
I mean, initially, no one wants to know that
their kid's done something wrong and gotten caught.
But what we do see is at the end of the program, both the adolescents themselves and then their parents have the opportunity to provide survey feedback. When we go through and read the survey feedback, it's phenomenal. What these adolescents are reporting that they've learned, ways that they've been able to just strengthen their own mindset, their refusal skills, and the growth that we see coming out
future
of their own words is phenomenal. And I think it also shows in the recidivism rate. I mean, so the youth that successfully complete our program have a less than 10% recidivism rate.
Wow,
and so it's a very effective program.
Yeah, almost closer to 5%.
But since you said those that complete the program, I'm compelled to ask, can they drop out? Do they fail? Do many fail to complete the program? Yeah.
So what I will say is, first and foremost, when we took on this program, we instituted a policy internally that we were going to do really assertive outreach to the families. Because if you just make one phone call to these families, or you leave a message and say you need to follow up, or this is going to go to the state attorney's office, the majority of those families are not quick and responsive to us. And so we are doing our part to educate the parents about the importance of the program, the risks that have been identified with their son or daughter, and what happens if they don't participate. And so
that's great.
We do a lot of educating. A lot of times parents are like, not my kid, or there's pointing fingers or the blame, or my kid was just standing by, and so we educate the parents of what the value of the program is. And really, for the majority, once they get that education, they are bought in.
And once they're bought in,
it goes smoother for the kids.
Yeah, the majority of them do enroll in the program.
Yeah.
And again, the completion of the program once enrolled is very high.
Yeah. And I would say the unsuccessful, I don't have the number off the top of my head, but it is very low.
Very low
the unsuccessful rate.
Well, I thank you on behalf of all parents for making those extra efforts. Because it's tough raising kids and holding a job and, all the rest of life stuff.
It takes a community.
And that is really why when, we had that space in Sebastian for drug testing, we started the prevention services there prior to the treatment because we really wanted to take that burden off some of the parents. And, and we really recognize that, it takes a village and we want to remove as many barriers as possible.
Well, again, I thank you because while we have raised many kids, the joke in our house for a long time between my husband and I was they ought to give us a sample child because this is unlike anything ever we've done. It's easy to watch nieces and nephews being, quote, raised, handled, whatever you want to call it, by family members. But when it's your own, when it is day in and day out, and it's just... it's important, but it's not more important than paying the utility bill and, going to work every day and taking care of A, B, C, D, E. Thank you again, because there should be no throwaway kids. I mean, but and as I've learned, each one of them's different anyway, so it wouldn't help if you had a sample to work on first.
It doesn't work that way.
So. One thing we have instituted in the last year or two is for the kids in our prevention program that demonstrate signs and symptoms of substance use disorder, we are now able to streamline them right into clinical services. We offer adolescent treatment programming, and that really was born out of, we've been doing this work a long time. Most kids have not developed a brain disorder. They haven't changed their brain to have the compulsion to continue to use. But our chief clinical officer in the last couple of years with the high content THC that kids are vaping, she was pulling her hair out, coming to me saying, Carrie, we're tracking multitude of high-risk kids that I need to now send off to treatment. They are not stopping. They cannot stop. And so we stepped into that gap in that space in our community to provide those services.
Well, and again, very grateful for that because as a healthcare provider, we know that that's a very specialized individual that treats that age set. And the burnout rate is fairly high compared to adults, So it's wonderful that you did step into that gap. Speaking of gaps, we're going to have a little gap in our programming here for a word from our sponsors. And when we come back, we'll talk more about some of the treatment and some of the other things that you've got going.
Sounds great. Thank you.
Thank you. Be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
If you dream of creating a home that embodies sophisticated island living, visit Sunshine Furniture now during our 50% off Tommy Bahama and Lexington Fall Home event. Bedroom, living and dining room, home office, media, and occasional pieces, Tommy Bahama furniture is distinctive and unique, yet inviting and comfortable, and is all 50% off. We're also having a floor sample closeout sale on outdoor furniture where you can save up to half price on selected closeout patio sets from Berlin Garden, Kingsley Bait, Brown Jordan, Telescope, and others. Chaises, chairs, sofas, love seats, dining sets, and fire pits, all built to withstand the Florida elements, and we specialize in replacement cushions, umbrellas, outdoor lamps, and rugs. Also, all pictures, lamps, and accessories are half price. Don't forget to visit our outlet and sales center directly across the street for the best deals anywhere. Sunshine Furniture, 1295 US 1 in Vero Beach. Visit our website at sunshinefurniturecasual.com and come in now for the 50% off Tommy Bahama Fall sale.
At Evergreen Media, we know the people, the businesses, and the work needed to take your marketing to the next level. We know where locals go to shop, work, and have fun.
We're here to focus on your local advertising so you can focus on your business. This is our home. This is our business. Evergreen Media. We market, you grow.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, and happy to have community members come and chat with me about different things that they're doing. It helps our collaboration. It helps us understand each other. We've been able to eliminate a lot of duplicity that way, but more importantly, we've assisted each other, and therefore I believe that we're assisting our patients to remove the silos and the barriers that afford them access. So today I have Carrie Lester Maynard and David Flint from the Thrive, formerly known as the Substance Awareness Center. I wonder if you'll ever get through with that. But it's been almost a year since you rebranded.
It has, yep.
And so, and a new location, but still doing the same great work of prevention and recovery. So let's talk about the recovery aspects. Again, this community is wonderful. It's probably 1,000% better than many in the state, but we do have some issues, and substance use is one of those, whether it's in our younger age set, middle age, or our senior population. The choice of substance, I'm guessing, is very different.
Well, I just like to remind people that substance use disorders are a medical condition. And so they do not discriminate. We see them across all socioeconomic classes, races, demographics, like you said, from our adolescents all the way to our older adults. And actually, surprisingly, this year, there's a lot of attention and focus on our older adult population. And we know we live in a community with a lot of older adults. Nationally, we have celebrated historic drop in overdose deaths. We went from over, I think, about 110,000 deaths the previous year to last year. We were down to 80,000 overdose deaths nationally. Now, 80,000 is still a significantly large number, but I think that comes to about like a 27 or 28% decrease that is really just unheard of in the public health sector. So we're celebrating our successes there. But in our senior population, overdose deaths increased nationally.
Really?
Yes. And so that is a population that we need to do more outreach, more prevention, and make sure that we have the specialty treatment services available for them. And so again, we were just talking in the earlier segment about our youth and our adolescent treatment, but we really need to look at it across the lifespan. WISE
is one of the new initiatives that we have. It's a prevention initiative. And when most people think of prevention, they think of adolescents, but it is an initiative and outreach targeting our senior population, being very well received here in our community.
Yep, it's an evidence-based program, so we're not making up what we teach. And
not winging it?
No, we're not winging it. The research really strongly shows that if we talk to seniors about aspects of healthy aging, we talk to them about risk of substance use, mixing medications and alcohol. It addresses social isolation, depression, and anxiety. So it's a very well-rounded program for senior wellness.
And so how do people hear about that or engage in that learning opportunity?
So we are offering it to the clients that we serve through our programming, but also we are looking for community partners to collaborate with. We brought the training. We have trained facilitators in our organization and out in the community. We have funding to bring the program to anywhere the seniors are. So if there's an organization or a group out there that has a cohort of seniors, we are happy to talk to you and bring the program. We've partnered with multiple organizations.
Indian River State College, multiple resident facilities.
St. Francis Manor.
Indian River County, St. Francis.
Indian River Estates, I think.
And what does the program look like? Couple hours a week for X number of weeks?
It's an 8-week.
It's seven lessons, and I think they're 90-minute lessons, and we can tailor it to the space that's available.
Sounds very interesting.
Yeah.
I might know somebody who might be facilitating for you. Okay. Because again, you're absolutely right. There are tips if you watch Facebook, scroll through, but it's not the same as listening to someone, being able to interact in those conversations, to debate your previous preconceptions, those types of things. So that's very exciting.
It's been very well received. The groups, when it's over, they're like, oh, can't we just keep having the lessons? And we were actually at the Florida Behavioral Health Conference this summer. We presented statewide on the work we're doing with the WISE program and had really good feedback and audience participation and questions about the program.
Yeah, absolutely.
So talk to us about your needs assessment that you recently did, because I have seen it and been very impressed by it. So this is your opportunity to kind of explain again to me, how did you come to do a needs assessment and of what population?
So we were tasked really by the county commissioners to lead the needs assessment for our community for opioids and other substance use disorders. And so we partnered with a research firm to do that needs assessment. You know, for me, the instruction out the gate was it was really important that we hear the voices of those with lived experience, whether it's people who have directly lived with a substance use disorder or been impacted by someone's substance use disorder. And we know...
So it wasn't limited to just people that have used opioids.
No,
which was a big deal relative to pain a couple of years ago.
Yeah. So we did it was a broad spectrum. We had focus groups. So we had focus groups of people with lived experience of substance use disorder, including opioid use disorder, but people with substance use disorder. We did a focus group for people with loved ones, so lived experience, because I love somebody who has struggles. We did service providers, because we know substance use disorder intersects across multiple organizations. And so we did those direct service providers, be it hospital setting. I think some of your staff participated, other treatment centers, mental health providers. We did, we invited law enforcement and first responders to a focus group, and then executive leadership in the county to focus group.
A lot of different perspectives then.
Yep. And we went we were in the jail. We interviewed inmates in the jail to get perspective. And then we rolled all of that information into a community-wide survey. So those focus groups informed a community-wide survey. We exceeded our target on the community-wide survey, so we know that the results on the needs assessment are generalizable, 95% confidence interval, that we can generalize the results to our community.
So with only 2 minutes left, I don't know how these 24 minutes just fly by. If people were interested in actually looking at the needs assessment,
come to our website. It is posted there. Reach out to us for more information on the work we are doing with that needs assessment and the strategic priorities that we've identified.
That data that comes out of the needs assessment really drives what we do as an organization. We're a very data-driven organization, and that guides our priorities in serving the community.
Well, and it certainly has had the ripple effect of informing a lot of those people who gave you the perspectives in terms of what are we doing to help fill some of the gaps that were identified. As you say, it's a community effort. It's not just a Thrive or a Treasure Coast or MHA or any of the
I appreciate you reinforcing that, because that is really important.
Yeah. So next steps.
Next,
you've got some fundraising coming up.
We have a couple of events coming up this Saturday.
Saturday, our 5K, 7:30 in the morning.
7:30 that late? Oh, good. Because I signed up. I was afraid it was 6:30. I was going to go to the website and look. Okay, 7:30 at
South Beach Park. And freedom5kirc.com is the website. And it's a wonderful event. This is probably going to be our biggest year yet. We're looking forward to it.
Yeah, well, we anticipate well over 200 runners, walkers out there. Great community support.
That's
very
wonderful.
Excited.
Yeah, well, you do great work, but work takes money. Staffing like to get paid, and so it is, I hope, a very successful event for you, because I know that you draw from a lot of different funding sources, as we all do as nonprofits.
But we count on our fundraising and appreciate the community support that day. You can walk up and register right on site or go to the website, as David mentioned.
Perfect. Well, thanks again for being here.
Thank you,
we'll try to make it more frequent. I think it's been quite a while. So again, thank you for being present with us to the end of the show, and I hope you dial back in next Saturday at 4:30 again. Take care and have a great evening.